This is BayCare Health Chat, another podcast from BayCare Health System.
Welcome to BayCare Health Chat. I'm Deborah Howell, and I invite you to listen as we talk about breast cancer screening and diagnosis with two experts in the field. Today we call our podcast, It's in Our Hands, Breast Cancer Screening and Diagnosis. I'm joined today by Jennifer Tisdale, a patient accounts coordinator, and Agnes Jastrzebski, a breast nurse navigator, both with BayCare Health System. Jennifer and Agnes, a true pleasure to have you with us today.
Thank you so much. It's an honor to be here.
Thank you for having us.
Agnes, let's start with you. How important is it for women to give ourselves self-exams, and how often should we be doing it?
So it's somewhat a tricky question, since many medical organizations don't recommend routine breast self-exams as part of breast cancer screening. However, self-awareness is very important and should be a regular part of your life. And of course, breast self-exam helps to increase your breast awareness. I believe it's very valuable for women to be familiar with their own breasts so they understand what's normal and promptly report any changes. It is so important to be aware, for example, if your breasts look different, if there's any lumps, if there's something that doesn't feel like it used to. And if you notice any new breast changes, you need to discuss these with your doctor. So for me, I still think it's important for women to do it once a month and supplement it with a yearly clinical exam by their gynecologist. So 3 things: screening mammography, self-exam once a month, and yearly clinical exam by a physician.
Fair enough. Now, what's new in the world of breast cancer screenings?
So mammogram is still the gold standard of screening. Now we have the digital 3D mammography, which is very beneficial to women, especially with denser or larger breasts. Our radiologists use the latest technology, including the 3D mammography and CAD, which is computer-aided detection. So in addition to radiologist eyes, there's computer-aided detection that's also looking through it. So it's very detailed screening. That's why screening mammography is a great tool, and it's your best option.
How important is early detection?
So early detection is key. Many women with breast cancer have no symptoms. Therefore, regular breast cancer screening is so important. If breast cancer is found early, there are more treatment options and a better chance for survival. Cancer is more likely to be smaller and also still confined to the breast. So with early detection, women are more likely to be able to undergo a simple lumpectomy, which correct medical term is partial mastectomy, instead of a radical surgery. So it's an outpatient procedure, and they go home that same day. Also, they are less likely to need additional treatments after surgery, such as chemotherapy. So early detection with regular screening mammograms not only leads to less treatment, but also improves the chances of survival from breast cancer. So with early detection and treatment, most patients have great prognosis and more successful outcome.
Thank you for that, Agnes. Jennifer, is there anything we can do to prevent breast cancer?
What I would recommend is that women start getting their mammograms at 40, which is the recommended age to start. Also, for younger women, they should start early with self-breast exams to get to know their body. And if they feel something that does not feel right to them, then make an appointment with their doctor.
Okay. What if I have a family history of breast cancer?
I would talk with your doctor to ask if early screening is necessary or even if genetic testing is another possibility to detect if a woman needs to start having their mammograms earlier than age 40.
And what are some deterrents to taking care of our breast health? And what would you say to someone who says they just don't have time for a mammogram?
I understand that life is busy and we sometimes do not make time for certain medical exams. From my experience going early for my mammograms, my breast cancer was caught early. So I would say make the time. It's so very important. Breast cancer does not run in my family, so I could have been one of those women who says, oh, I'll go next year, I'll skip a year. You just don't want to think about the what if. Make the time. It's your health.
Absolutely, and I'm so pleased for your recovery. Agnes, let's talk a little bit about diagnosis. What happens when I get diagnosed with breast cancer?
Once you find out you have breast cancer, usually next step is to get your MRI scheduled, and imaging department will tell you if you need that or not. And then you meet with a breast surgeon. That's when I contact the patient to provide a free, individualized guidance. Nurse navigating service is offered to anyone who has been diagnosed or treated for breast cancer at Morton Plant Hospital. My role is to help breast cancer patients throughout every aspect of treatment and to assist them as needed with coordination of care that's prescribed by the patient's physician. So I serve as a liaison between the patient and their physicians or medical team to ensure better patient understanding of medical recommendations. So what that means, I help to clarify the medical information overload and help them overcome their barriers. Patient receives education, resources needed, and also information of what needs to be done. It's during this difficult time that I try to lend them my support, my courage, my heart, and I try to do that until the patient can find their own strength and courage. The goal is to empower them so that they feel in control again. I would also like to mention our CAPS, our free CAPS program. CAPS is Cancer Patient Support Services. It includes counselors and social service workers who help cancer patients and their families cope with the emotional and physical changes that result from cancer diagnosis. So CAPS team is committed to treat the whole patient, their body, mind, and their spirit. And the goal is to provide patient with valuable coping skills, and supportive environment. So it's a very valuable program, and it's free.
Oh, I love it. That is wonderful. Tell us a little bit more about the staff at Baycare Breast Centers.
Our Baycare Breast Centers are accredited, use the latest technology, have certified breast cancer navigators in imaging and also in other departments. They offer free CAPS program that I mentioned, multidisciplinary breast tumor board every Friday, and I might be a little biased, but we have the best doctors. Our physicians are board certified in breast, and they specialize in working with breast cancer patients. So our breast centers are very breast specific and breast focused. Our Breast Tumor Board Conference is a weekly meeting of breast surgeons, radiologists, pathologists, medical oncologists, radiation oncologists, cancer patient support services, nurse navigator, research team, genetic counselors, and also other ancillary staff. And everyone, they all meet together to discuss the cases for breast cancer patients. The purpose of these discussions is to provide quality care for each patient. Cases are presented prior to initiation of treatment to ensure the optimal coordination of care. Also, some cases are discussed after surgery, and that is to review how pathology findings might change management. So it's a multidisciplinary and comprehensive team approach that is a central part of deciding the best treatment approach for each patient. I feel very fortunate and blessed to be a part of Baycare's Breast Center team because everyone works together to provide the best care for our patients, and we work really well together as a team.
Well, I can hear the passion in your voice, Agnes. It sounds like a wonderful environment for your patients. Agnes, how did Stories of Strength come about?
So these stories came about because educating women about breast cancer is very important. We need to empower women to take control of their breast health by reminding them that their health is literally in their hands. Things like lack of education, for example, or lack of accurate information, or lack of financial resources can be a deterrent for women to take the important steps in managing their breast health. So Stories of Strength help to educate and encourage women to take action and to take it today. I just want to add that one of my best friends had her mammogram done last week, and it's because she watched the video, heard the stories of strength, was encouraged to take control of her breast health, and she took action. So I hope more women will do that as well.
Excellent. Jennifer, what's the best part about your job?
The best part about my job, I do love working for Baycare. I have been employed for 5 years now. I love the team members, and we all work great together.
Is there anything else you'd like to add to our conversation for the women listening now?
I would like to add that, again, breast cancer awareness is so very important. Start speaking with your doctor about when to get your mammograms and doing your self-breast exams, and then making sure that you're going yearly for your mammograms and keeping that appointment.
And how can I make an appointment for a mammogram and get a physician referral?
I would speak with your primary care doctor or your gynecologist for the referral. They will be able to direct you to the appropriate center to schedule your mammograms.
And I'd like to add to that if I may. For more information on breast health services at Baycare, you can also visit itsinourhands.org. This has been so enlightening. Thanks for all the insight you've both given us today.
Thank you so much. It was my pleasure.
Thank you very much.
And that wraps up this episode of Baycare Health Chat. Head on over to our website at baycare.org for more information and to get connected with one of our providers. Always remember to subscribe, rate, and review this podcast and all the other Baycare podcasts so we can share the wealth of information from our experts together. This is Deborah Howell. Have yourself a terrific day.